Hello and welcome. If you or someone that you know and love is turning 65 soon and needs to understand a little bit more about how Medicare works, you've come to the right video. I'm going to share with you what I call the roadmap to Medicare and explain to you your Medicare options. I think you're going to get a lot out of this video. Even if you've been in Medicare for a little while, you've been Medicare eligible for a few years, and you just want to kind of get a refresher as to how everything works, this is going to be a great opportunity for you to get that refresher. So let's get started. So first of all, welcome to Medicare Roadmap. That's what we call this presentation. We're going to help you understand your Medicare options. So first of all, my name is Paris Clough. I'm an independent insurance agent. I'm licensed in the state of California and the state of Utah. You can check my licenses there if you'd like. I am not a Medicare, CMS, or insurance carrier. So it's important that I don't belong to or represent those particular organizations. What I do is I help Medicare beneficiaries, people who are eligible for Medicare, understand the decision process and help them choose a Medicare plan or option that best suits their needs. I do not charge for this service. However, I do get paid and compensated by the carrier. So for example, if we work together and we decide that XYZ company is the best company for you, then XYZ company will pay me a compensation or pay me a commission when you enroll in a plan. So that's how that works. So that's kind of good to know. So the other thing is, this is not going to be probably the most exciting thing to know, but it's definitely one of those things that you're going to want to know. Medicare is a whole different animal than traditional insurance, so it's important for you to pay attention and to learn what I can do. I'll try to make it as exciting and as informative as possible. So first of all, in order to be eligible for Medicare, you have to be 65 years old traditionally, unless you have a disability or other extenuating circumstance that allows you to have Medicare before 65. You have to be a U.S. citizen and have been legally a resident inside the United States for a consecutive 5 years in order to be eligible for Medicare. Now, Medicare has two parts, Part A and Part B. We're going to get into those. There's two paths for you to choose when you get your Medicare eligibility. There's two major paths for you to go down to be able to pick what you're going to do. We're going to get into that as well. But if you have any questions about your eligibility, if you don't know if you're eligible for Part A, Part B, if you are just turning 65 and you don't know how to get enrolled in Medicare Part A and or Part B, then I would recommend contacting your local Social Security office. Or you can call 1-800-MEDICARE, which is 1-800-633-4227. If you're a deaf and you're reading this maybe through the captions, you can call 1-877-486-2048 and you can get through to them. Also, Medicare.gov is a great resource if you're internet and tech savvy and want to jump on the internet to find out what's going on. Medicare.gov is great. You can actually establish an account there and enter your information and I think you can apply for your Medicare card. I've had several of my clients apply for Medicare through the website. So that's a great way to do that. You can always call me. You see my numbers there. You can contact me anytime you want. I'd be happy to help. If it's one of those initial eligibility questions, I'll probably have to refer you back to Medicare or your local Social Security office, but I definitely would love to help in any way I can. Various points throughout this presentation, I'm going to have my contact information if you want to get a hold of me for any reason, but I just want to make sure that you know that I am only licensed in the state of California and the state of Utah. So if you're listening to this or watching this from a different state, you might have to reach out to somebody who's local to you. I do have access to a nationwide network of agents like me. So if you do want to contact me, I might be able to put you in front of somebody. So please don't feel, please still reach out to me and see what I can do to help. So as I shared earlier, there's really two paths. Oh, I wanted to share with you for sure this particular Medicare card. This is what it looks like. It's a red, white, and blue card. It's important to have it. Once you have the Medicare card, it's important to keep that close to you in a place where it's going to keep it safe. It has your name, your Medicare number, and then your hospital at Part A and your medical Part B eligibility dates. So those are all important for you when enrolling in one of the paths that I'm going to talk to you about. You're going to need to have this card. You're going to need to have the information, at least on this card, available to speak to the agent or the person that you enroll with. So that's important to know. So there's two paths to Medicare and how Medicare can cover you. The first path is Part A, having just Part A with hospital costs, Part B with doctor and outpatient care, then Part D, which pays for prescriptions at the pharmacy, and then a Medicare supplement insurance plan. We're going to get into each of these paths pretty detailed, so just bear with me here. Path 2 is a Medicare Advantage plan, or that's Part C. So a lot of people are like, Part A, Part B, Part D, what happened to C? Well, Part C is a Medicare Advantage plan, and that's provided by private insurance companies in partnership with Medicare. Medicare pays them a monthly fee, and then they can provide the benefits that are available in the state or county in which you reside. So Medicare Advantage plans and or Medicare supplements. Those are kind of the two paths that are really available to you. So the first path, which is original Medicare with a supplement, and a prescription drug plan, what we call a standalone prescription drug plan, is one option that you can choose. Part A, what that does is with original Medicare, you have Part A, which helps with hospital costs. There's no monthly fee or monthly premium for your Part A. Typically you get your Part A because you paid taxes, Social Security taxes throughout your life. And so as you worked, if you have done that, then you're going to get your Part A. Some people may or may not have done that, and so they have a premium, but that's very rare. More often than not, you're going to not have a premium for your Part A. Now, Part A covers anything you'll do in an actual hospital facility. So there is a deductible of $1,632 in 2024. If you're listening to this in a different year, make sure you Google or Bing or whatever search engine you want to use, go online and find out what the deductible is for the year in which you're watching this, because that's important to note. If you go to the hospital for any reason, if you're there for a day, if you're there for a week, if you're there for a month, it's always going to be that $1,632. So what happens though is once you get discharged, if you go back into the hospital 61 days later, then you get it, that's charged again. So technically, if you really think about it, you could be 60 days is about 2 months. There are 6 2-month cycles in a year. So if you really want to kind of calculate what the risk might be there, is that you would take 6 times 1,632, which is in the neighborhood of $9,000 or $10,000, and that's going to be your maximum risk if you had a catastrophic year full of medical emergencies. Every couple months you're in the hospital. That could be what you're looking at for cost. Part B, as in boy, is for anything you do outside of the hospital. So it's doctor's visits, specialists, primary care, labs, x-rays, anything that you'll do, even outpatient surgeries are covered under Part B. Sometimes there's even some prescriptions or some drugs that are covered under Part B that you get from your doctor. Those are all covered, and that's at an 80-20 split. So there is a deductible with Part B. It's $240 in 2024. Check that whatever year you're watching this video. Make sure you're checking for the Part B deductible in the year in which you're watching. Also, it's an 80-20 split. So if you go to if you go to the doctor's office and the doctor charges $100 for the service, Medicare will pay $80 and your responsibility will be $20. Now, there is no maximum to that. So you could, if you go to the hospital, if you go to the doctor's office, have labs, have x-rays, have everything every month, then your 20% could be significant as you add that up throughout the year. So a lot of people will take original Medicare and they'll go get a prescription drug plan. It's important to note that if you don't get your prescription drug plan, we're going to talk a little bit about this later, but you need to get a prescription drug plan right away. Otherwise, there's some penalties that are involved. We'll talk about that again in a minute. But Part D covers your prescriptions, anything you do at the pharmacy. So it's your outpatient prescriptions. It does not cover anything. Let's say you're at the hospital and they need to administer some drugs to you to be able to get you through surgery, maybe pain medicines, things like that. If it's at the hospital, that's all covered under Part A. If it's at a doctor's office, that's going to be covered under Part B. But anytime they give you a prescription to take to a pharmacy, that's Part D. Part D is going to be where you're going to need to have some coverage there, because those prescriptions can be very expensive. So when you do enroll in a Part D plan, you're going to want to make sure that you have all of your prescriptions available. One thing to note as an agent, it's very important if you're talking to your agent to make sure that the prescriptions, the bottle for the prescriptions or the spelling is right there in front of you, because one letter on some of these prescriptions and it's a whole new drug. So it's very important to get the spelling correct, but make sure that all of your drugs are covered and at a decent copay and a decent premium. So there is a monthly premium for Part D. There's also, by the way, I don't know if we're going to talk about this here in a minute. We should, but there is a premium for Part B, as in boy. So Part A doesn't have a premium. Part B has a premium. Part D has a premium, and your Medicare supplement will have a premium as well. So depending on the supplement that you choose, the premium could be different. So that's important to know. The supplements are really good. We're going to talk about the advantages and disadvantages of supplements here in just a minute. Again, in order to have Part D, you don't have to have Part B. But if you want to have a Medicare supplement, it's a good idea to get Part A and Part B and have that pay that Part B premium, and then you pay the Part D premium and the Medicare supplement premium. So you'd have 3 cards. You'd have a Medicare card, your Part D card, and your supplement card. So just remember that. Keep that in mind. So private insurance, Medicare supplement plans are private insurance companies that provide extra coverage above and beyond what Medicare provides. So what the advantages are, that deductible that we talked about for your Part A is as long as you pay your monthly premium to the supplement will pay that deductible for you. So you don't have to worry about that. That's kind of nice. So it limits the maximum on which you'll have to pay. So it's just really the monthly premium for the supplement would be your maximum cost for the year. Depending on which supplement you choose, you might have other costs. One of those is a Part B deductible. That $240 deductible is still going to be there. I think all the plans require that are available for people turning 65 right now. If you turn 65 before the year 2020, then you might have Plan F available to you. And Plan F is a little higher premium, but it reduces that Part B deductible. You don't have to pay that. It is very flexible. Supplement plans act like PPOs. They are not PPOs, but they act like PPOs in that you can go to any doctor that accepts Medicare. So if you want to go to a doctor, say your neighbor says, hey, you need to go see this doctor. He's the best one ever. He did my surgery, my mom's surgery, my dad, whatever. You got to go see him. Well, if you have Medicare and a supplement and you want to know if the doctor sees him, just call the doctor and say, hey, doctor, do you guys take Medicare? If they take Medicare, they're going to take the supplement. And so that's good for you to know, to be able to, you can travel with it, supplement, you can go anywhere in the United States, especially. And some plans, depending on the plan you choose, may have coverage outside of the country. So just make sure that you're aware of that. The other thing, some of the disadvantages that the plan premiums do go up year after year. They usually give somebody turning 65 brand new is going to have a little bit of a discount. For most of the plans, they offer some, introductory rates, but those rates do increase every year. And so just be aware of that. And also, if you have significant health concerns and you're not applying for a supplement at the right time, you could be denied coverage, because they do have underwriting. In many cases, they will have an underwriting opportunity. So there's certain situations, depending on the state in which you live and or the time that you're getting your supplement. Usually, if you're brand new to Medicare and you just got your Part A and you just got your Part B, you're going to have a guaranteed opportunity to get a supplement. If you wait longer than that, though, you may or may not be able to get your your supplement, or even your Part D, which we're going to talk about here in a minute. So Part D there's 4 things to really think about or know when it comes to Part D. And I'll add a few things here that I've experienced over the years as an insurance agent, which I've been doing, by the way. I don't think I mentioned this earlier. I've been an insurance agent for over 20 years, and I've been doing Medicare for about 15. So the formulary is important. That's the list of drugs. Every carrier can determine which tier. There's different tiers, and the tiers determine the copay at the pharmacy. Every carrier can determine what tier their prescription is going to be on, or the particular drug is going to be on. Most companies are not required to have every drug. However, they are required to have every category of drugs. So they may not have ABC drug that does, works for, high blood pressure, but they would have a DEF drug that works for high blood pressure. So the ABC drug, if you're taking the ABC drug for your high blood pressure and the formulary only covers the DEF drug, you're going to have to switch to the DEF drug. Or in some cases, they do have formulary exceptions, and it's not impossible to get those, but don't count on them. Try to find a prescription carrier or a prescription drug plan that actually covers the drugs you're on right now, so that you don't have to worry about trying to get exceptions and things of that nature, because it's a process and it's not guaranteed. Again, Part D plans have a premium and there's a copays. There's 4 real levels of the phases. There's 4 phases to Part D, which we're going to talk about in a minute. But there's sometimes a limited network of pharmacies that are available depending on the Part D plan that you choose. And number 4 here is the late enrollment period. This is important to note. If you do not sign up for a Part D plan within 63 days of your Part A and Part B eligibility, you could be have what's called a late enrollment penalty. The late enrollment penalty is 1% per month you don't enroll that you could have enrolled of the average price of a Medicare prescription drug plan at the time that you do enroll. So that could be, a few dollars, a few cents. I actually have some clients that pay, they only missed a few months, so they have a very small late enrollment penalty. And then I have others that missed years, and they have a much larger enrollment penalty. So if you can, make sure you get a Part D plan right away. Even if you're one of the things though that to consider is if you don't have any prescriptions and you're brand new to Medicare and you're going to go this route, um, you may not want to pay for a prescription drug plan just to pay for it and just to avoid a penalty. So the money that you'll save sometimes can be worth it if you do the calculations. Just work that out with your agent. Maybe do a little bit of math yourself and see if it's worth it. So I'm going to talk about the 4 phases of prescription drug coverage here. And the first phase is the deductible phase. And in 2024, it's $545. What that means is if you have a plan, some plans don't have these. Most plans do, but some plans don't. So just in case, if your plan does have a deductible phase, what that means is that whatever the price, let's say your prescription is on a tier 1, which is traditionally 0 copay. Unfortunately, for the first $545 of your prescription coverage, you're going to have to pay full price for that prescription. Once you hit the $545, though, it will go back to that copay, which is phase 2, which is your initial coverage limit, and that's based on copays. So you'll pay a copay at the hospital. You'll pay a copay at the pharmacy when you pick up the prescription. Now, another thing to remember is that the total value of, or the total retail cost of that prescription is still calculated by the government. So let's say, for example, that you have a drug that costs $100 retail, and that's what it would be with no insurance. But your copay is only $5. So you only pay $5, but the total retail value of that drug is $100. Well, that $100 adds up every month, and if you have 10 or 15 prescriptions that are $50 to $100, all of that adds up. Every month that you take those prescriptions, they add up the total retail cost, and then every month they add it up month after month after month. And if you ever reach $5,030, and this again is the 2024 numbers, so if you're in a different year, check the numbers for the year you're in. But if you reach $5,030 of total coverage, you then are out of the initial coverage limit, and you go into what's called the coverage gap. Now, the coverage gap is traditionally referred to as the donut hole. I tease people sometimes about being in the donut hole. Sometimes that sounds like it's a good thing, and if it was real donuts, it might sound like a good thing, but it's not. Being in the coverage gap is a little more expensive. So instead of a flat fee of a copay at the pharmacy, what you would pay now is a percentage fee, a co-insurance, and that's 25% of generic drugs and 25% of brand name drugs. There's a few nuances there for you to read on the screen if you'd like to. But once you're in the coverage gap, again, they still continue to keep track of the total retail value of the prescriptions as you get them each month. So if you reach in the coverage gap, if you reach $8,000, again, this is the number for 2024. If you reach $8,000 in total coverage, then you enter what's called the catastrophic phase. And the catastrophic phase is where you don't really pay anything anymore. So that's what 2024 is. Depending on the year that you're in right now, the rules may have changed. Medicare kind of does some things every year sometimes. So just be aware of what's happening in the year in which you're in. So remember the 4 phases of the Part D coverage. Remember the late enrollment penalty. Those are some of the most important things. Let's just really do a recap summary of Path 1. So first of all, you can have any combination of the parts below under Path 1, up to 3 insurance cards at one time. Remember I shared earlier, you have your Medicare Part A and B card, you have your Part D card, and your supplement card. So that's 3 cards in your wallet. So Part A is hospitals, Part B is anything you do outside of the hospital, doctor's offices, outpatient care. Part D is prescriptions and anything you do at the pharmacy. And then Medicare supplement insurance picks up anything that Medicare doesn't cover under Part A and Part B. And so there's some great, there's a lot of plans out there. Actually, some of the supplement insurance plans are adding a few bells and whistles. They add some fun little benefits like gym memberships and other fun things. So just be kind of willing to shop around and take a look at what's available and what's out there for you. So let's jump into, I know that, thank you for making it through Path 1. Let's jump into Path 2, and we'll get through this as fast as possible so that you guys can get on to the next thing you want to do. But I think this will be helpful to you. So let's jump into Path 2, or what we call Part C Medicare Advantage plans. Part C is a single plan offered by a primary insurance company that combines A, B, and most of the time D. Some companies, some places, some counties, some states don't have Part D, or they have Part D and a non-Part D Medicare Advantage plan. So just be aware of that. So if you get a Medicare Advantage plan, there's, depending on where you live and the state you're in and the county that you're in, the Medicare Advantage plan may be a little bit different, but this is going to be kind of an overview of what these Medicare Advantage plans look like. Now, there's a lot of there's a lot of things in the news about how Medicare Advantage plans work. I've been doing this again for 15 years. I have almost 300, just over, I have several hundred clients that are on Medicare Advantage plans. And there's, as long as you're on top of things and you're working together, I've not had any major issues. A lot of the scare tactics that are out there about what's happening to people on Medicare Advantage plans, I haven't experienced in 15 years and hundreds of clients. So I do know that there's some situations out there, and I've had a few things that I've had to help my clients with, but overall, I've had a very good experience, and most of my clients are extremely happy. If you do a search, by the way, for Paris Clough insurance broker, you'll see that I have 5-star reviews. So it's really been a great run. So one of the most things that to also remember here is that Medicare Advantage plans can be some of these traditional things that you remember from when you were working. They can be an HMO. They can be PPOs. There are Medicare Advantage plans that actually cover special needs people who have maybe heart disease, diabetes. There are people who have Medicare Advantage plans that are for low income. Those are called dual special needs, people who have dual eligibility for Medicare and Medicaid. So we're going to talk about that in a minute as well. Medicare Advantage plans are not Medicare supplement plans. They're totally different. In fact, one of the most important things to remember is that you cannot have a Medicare Advantage plan and a Medicare supplement. I had a guy call me once years ago, and he was telling me that he could not get his bills paid for. He was frustrated. The insurance companies were frustrating. He asked me, please help me. What can I do? And I've come to find out that he had enrolled in a Medicare Advantage plan with an agent, and then he went online himself and enrolled in a supplement plan at the same time. And the problem is, first of all, that's for agents. I can't. It's illegal for me to enroll somebody in both in a Medicare Advantage plan and a supplement, or knowingly enrolling them in another one when I know they have the other one. And so he did this himself online. And what ended up happening is the insurance carriers ended up fighting about who was going to pay, and nobody wanted to pay. So there's some of that. You got to just be aware of that. You will continue to pay your Part B premium, as I shared earlier. I think in 2024, it's $174.95. So whatever year you're in, make sure that you're checking for that Part B premium. You have to pay the Part B premium in order to qualify for Medicare Advantage plan. So you have to have Part A and Part B in order to have a Part C plan, which does include, in many cases, a Part D benefit. Some of the advantages, it's a single enrollment, just one plan, covers everything, super easy, and have usually got tons of bells and whistles. They usually like to load these things up with all kinds of fun, fancy things. Most of the Medicare Advantage plans out there have a zero premium, so it's really nice because there's no additional premium to pay above and beyond your Part B premium. That makes it very economical, and a lot of my clients love that financial benefit of having a zero premium. Most of them have very low copays, if any. And so depending on the area where you live and the county where you live, you can have a really good benefit for that. Most of the time, again, they're better than what Original Medicare offers. And you have to live in the county where that's available. I have sometimes clients call me that have friends in other counties. They're like, say, hey, I want to get the Medicare Advantage plan my friend has. And unfortunately, it's not available in the county where they're living. So I have to tell them that. So that's one of the disadvantages, that you have to live in the service area where they offer the plan. If you're on an HMO or a private fee-for-service Medicare Advantage plan, you're going to have a limited network, or you're going to have to use the network that the HMO or private fee-for-service plan uses. In some counties, most counties, those are very robust networks, huge networks. I personally very rarely run into a situation where somebody can't find that their doctor accepts one of these plans. Every once in a while, I'll find one, but it's very rare. Hundreds of clients, and very small percentage of them have an issue with whether their doctor. And that's just because maybe that's where in California and Utah, it's not as difficult. Maybe some other states, it's a little more difficult to do that. So I hope that's not your case, but just be aware of that. Also, if you have end-stage renal disease or some kind of situation where your health has got a specific issue, you might have a specific plan that you need to enroll in or be aware of that's available for you. So just be aware of that. Also, with Medicare Advantage plans, that they are good for one full year. So it's 12 months, January 1st to December 31st. The plan, if you don't do anything, you automatically get enrolled the second year, but they can change the contract. That particular plan's all of anything is up for grabs at the end for the new year. So it could change completely. So be aware of that. Just be ready for any information that you receive in the mail towards the end of the year about any what's called a annual notice of change. We call it in the industry the ANOC, A-N-O-C, annual notice of change. So just be aware of that. Don't throw those letters away because if you get stuck in the plan that you thought last year and it totally changes for next year, you're going to be frustrated. But there are some things we'll talk about here in a minute for you to do in case that happens. Again, also, if you're in an area, if you move to an area and you're out of that area where you used to have a Medicare Advantage plan and you're in a new area for more than 6 months, you're going to have to enroll in a new plan. So and when you move, there's some eligibility opportunities for you to get an enrollment. So you don't have to be stuck or wait for the enrollment period. You can actually change because you moved. As long as the plan that you're in is not available in the county that you move to, then you can switch to a plan that's available in the county that you move to. So you need to be aware of that. So you have 6 months to change. Another eligibility requirement is that you must be, again, enrolled in Part A and Part B. You have to continue to pay your Part B premium. You have to live in the plan service areas, which we've already talked about. So Medicare Advantage plans have different election periods than a supplement does. So every year you get a chance to enroll in a plan, but your initial, as you turn 65, the month that you turn 65 is your initial enrollment period. You get 3 months before that date. So let's say, for example, you get your Medicare card in the mail, and let's say that it says, for example, March 1st. So you have January, February, you actually have December, January, and February that you can enroll in a plan starting on March 1st. You have the month of March, and you have April, May, and June to enroll in plan. Medicare Advantage plans start on the first of the following month of your enrollment. So if you sign up, let's say, for example, that today it's the 15th of, well, actually today is the 14th of February as I'm recording this video. Let's say we enrolled you today and I could not start your plan until March 1st. March 1st, your plan would start though, and you'd be able to use that. So beyond your initial, when you first are eligible for Medicare, sometimes people have Medicare Part A and then they wait to get their Part B later. There's different rules for that. If that's your situation, please feel free to reach out to me. I'll give my contact information here a little bit later on a couple slides. But it's important to note that there's different rules. The traditional, the most generic, easiest, everybody kind of needs to know is that when you get your Part A and Part B card, when you get your Medicare card, that date, that eligibility date, you get the 3 months before, the month of, and the 3 months after that to enroll in a plan. So make sure you take advantage of that. If you don't take advantage of that, you're going to be stuck till the next enrollment period and you're going to be without whatever coverage you might need, unless you can get a supplement that will cover some things there. But this does, by the way, not just Medicare Advantage plans, this also kind of relates to Part D plans. So there's enrollment periods for your Part D as well. So there are, every year from October 15th to December 7th, you have an opportunity to enroll for the following year. And so you can change plans, you can change carriers, you can change all kinds of things during that open enrollment. It's called AEP, or annual election period. There is another enrollment period. Let's see if we're going to talk about that here in a minute. That's January, February, or March. It's like a one-time, oops, like I didn't enroll in the right plan, I want to make change and do that. You can. That's a one-time opportunity for you to be able to do that. It's called open enrollment. That's during January, February, and March. You get one shot, one chance to switch to another plan, from one Medicare Advantage plan to another Medicare Advantage plan, or to drop your Medicare Advantage plan and go back to original Medicare with a Part D prescription drug plan. So there's certain rules there, certain situations. I've just shared with you kind of the basics. If you have any questions, again, let's reach out at the end of this video. I'll give you some information and I'll put a link in the description below for you to reach out for specific questions you might have. So decision process of path one. First, step one, decide if you want or need Part C or Medicare Advantage plan. Make sure you're enrolled in Part A and Part B. And then step two, review the plans that are available in your county where you reside. the plan types, the provider directories, the formularies, the benefits, and the premiums, and then enroll in the plan that best suits your needs. And you're going to want to talk to. I personally am an agent, so I'm biased. So I personally believe that it's better for you to contact an agent, an independent agent like myself, to get that coverage. One of the great things is that when I have a lot of clients that will call the 1-800 number to the company, they'll get enrolled, and then they'll call me and they'll say, Paris, I need help. The 1-800 number takes forever. They don't know, understand. I said, I'm sorry, I'm not your agent. I can't help you. Sometimes I'm able to take over and become their agent, and then they have a cell phone number. They can call me anytime. In fact, I was talking with one of my clients at like 7 or 8 o'clock last night. They had a question. They called me. I answered. We were able to help them answer that. So one of the good things, not every agent is like that. Not every agent is not agent. Let's just put it this way: not all agents are created the same. But if you can find a good one that's going to service you and be there and be available for you and be able to help you with any concerns you have, man, it's going to be that is the premier situation to be in. So another thing to be aware of for those that have what's called low income or opportunities for, they're on a fixed income or limited income, there is extra help. You can, if you don't qualify, of course, there's Medi-Cal in California and Medicaid in every other state. But if you don't qualify for that, you might qualify for low income subsidy, which is prescription drug coverage assistance, where sometimes they'll pay your Part B, some of your Part B premium, and then they'll also pay for quite a bit of subsidy on your prescriptions at the pharmacy. So it can be, you can have higher income limits and higher assets than traditional Medicaid or Medi-Cal. So make sure you call your Social Security office or Medicare in order to get more information about whether or not you qualify. I think if you call Medicare or Medicaid, you can actually, even the Social Security office, you can ask them, hey, I would like to qualify to see if I qualify for the low income subsidy. Please help me out, and they'll point you in the right direction. Again, if you call me at the numbers listed there, you're going to be able to get a hold of me, and I'll be happy to help. I'm not a Medicaid representative. I'm not a CMS or Medicare representative or insurance carrier. So if I can answer the question, I will. If not, I will refer you to the right places. I'll point you in the right direction for sure. So the other thing too that's important to note when it comes to Medicare is you have the right to appeal and you have the right to file a grievance. You do not lose your Medicare rights and privileges when you enroll in a Medicare Advantage plan. In fact, the analogy that I use is that that Medicare is still in the car, but a new carrier is driving. So let's say that you sign up with XYZ company and they're your Medicare Advantage plan. They're going to drive all of your medical issues, your claims, your administration, everything that you do with doctors, hospitals, labs, x-rays, anything that you do for your health is going to be put through them. Now, if they do something you don't like or that you feel is not appropriate, you can file an appeal, file a grievance, and you can contact Medicare directly to do that, or you can contact the carrier, the XYZ company, and say, hey, look, I want to appeal this decision, or I want to file a grievance against my doctor or this facility or this procedure or whatever. You have all those rights to do that. In fact, I've helped several of my clients do that over the years. So what are your enrollment options? Well, you can do that virtually in home. You can have a consultation on appointments. You can have one of the things that we do is when we go, I have most of my appointments are by phone or virtually, and then I send out a link so that you can review and enroll. We go through all of your doctors, make sure all your doctors are covered. We go through all your prescriptions, make sure all your prescriptions are covered. And then we find the plan that works with both your doctors, not just your primary care doctor, but also your specialists. It's important to note that. So your primary care doctor, your specialists, and the prescriptions, we find the best plan that covers all of those things and then gives you some extra bells and whistles that you might be looking for and interested in. So if you want to know more about, if you live in the state of California or if you live in the state of Utah and you want to know more about your enrollment options, you can contact me at the numbers listed there. In California, it's 559-825-1678. In Utah, it's 385-448-0777. I'm going to have my email address here in a minute too that you can use. In the next slide, I'm going to show you my email address so that you can use that. But it's no fee, no obligation. I don't get paid unless you enroll in a plan, and then I get paid from the person or the company that you enroll in. So again, there's paper applications, which is face-to-face. I do have, if you're local to me, I'll do that. I'll come to your home and we'll do that. If you're not local to me, I definitely will have to do it over the phone, where I send you a link, whether it's a text or an email. and then you can just click a link, easily review everything, and click submit. And I'm right there on the phone with you the whole time, holding your hand and making sure that you know everything that you need to know in order to make the right decision. I do not want somebody to enroll in a plan that's not going to fit their needs. It doesn't look good on me or my business, and I pride myself on my reputation. I've got a 5-star review on Google, and I want to keep it that way. I also have 15 plus years where I've never had a complaint or any issues. So I definitely, that's more important to me than making a few extra dollars by doing something strange. So the next steps for you is to determine the timeline for enrollment. So if you're going to be turning 65 in the next month and you need to have somebody talk to you this month, we need to get on the phone. If you're going to be turning 65 later this year, then don't worry about it. If you're listening to this and it's near the open enrollment period, you're going to wait probably to call me after October 15th or near October 15th so that we can talk about what your options are going to be for next year. I'd love to chat with you again. We want to make sure that we cover all the bases, that your doctors are covered, your medications are covered, and we find a plan that fits into your budget with all the copays and the different co-insurance issues. Call me anytime. You see my numbers there. You can email me at parisclough@gmail.com to get more information as well. I'll respond to those emails. You can call or text, by the way, any of these numbers, 559-825-1678 in California. You can text that number or call. Utah, it's 385-448-0777. You can call or text that number as well. Be happy to help any way I can, answer any questions that I can. Thank you so much for joining me in this presentation. Hopefully I didn't bore you to tears. Hopefully you learned something new, and you got some the information that you were looking for on what to do for your Medicare. If you are a recipient or becoming eligible yourself, what to do, or if you have a loved one that is becoming eligible for Medicare, hopefully you now know what to do for them. One last thing I'll share with you: if you have a special need, let's say you have diabetes, or you have chronic heart conditions, or you have some kind of chronic issue like that, you have a special election period. You can enroll any time of the year. You don't have to wait till October. You don't have to wait for a specific time of the year. You can enroll anytime. Also, if you are Medicare and Medicaid or Medi-Cal, you can enroll several times throughout the year. There's not you don't have to wait till October 15th either. So just know if you're in those situations to please reach out to me, and let's see what we can do to help find you a plan that's going to fit your needs the most effective way. So once again, my name is Paris Clough, and I am an independent insurance agent. I love helping people find the plan that's right for them, and I love helping people get the right kinds of insurance that they need. So thank you again for watching. Thanks for joining me today, and have a great and fantastic day. And I hope your journey through Medicare is a wonderful one.